When patients have a medical problem that is undiagnosed or that's newly diagnosed, it's very scary. And patients need to feel that they are in good hands. They need to be able to trust their caregivers. And the doctors at MGH and the doctors in the Department of Radiology are absolutely expert at what they do.
In terms of evaluating a patient, not just a patient who has known cancer, but a patient who may have cancer, imaging is critical. So for example, kidney cancer. You have a tumor in the kidney. How big is it? What's the anatomy of the kidney? What's the anatomy of the tumor?
A lot of my patients have a lot of anxiety about X-ray exposure. So it is good to be able to say to them that our radiology staff have designed a way to deliver a much lower dose of radiation with the CAT scan than many other places.
Safety is our #1 priority, and we have always worked hard in keeping our radiation doses as low as possible.
Our department has created amazing breakthroughs. We operate at the cutting edge of our field, and patients can be assured that they're going to get the most up-to-date, current approaches to medical imaging and image-guided intervention that are possible.
Digital breast tomosynthesis. Many patients may have heard about it as a so-called 3D mammogram. The technology was developed here at the Mass General, and we were the first site in the United States to implement tomosynthesis. Tomosynthesis can increase the numbers of cancers that we detect on a screening mammogram. Not only does it help me as the breast imager to see more cancer, but it helps me to see fewer things that are not cancer.
Having subspecialty radiologists is a terrific advantage for being able to have individuals who focus on specific diseases and pathologic conditions.
It allows the radiologist to be absolutely current on the latest treatments, surgical techniques, and the things that are important about the imaging studies that relate to them. And then the second reason is that it gives us a common language. When I'm a musculoskeletal radiologist, so when I talk to an orthopedic surgeon, I know what he's thinking about.
Many of my patients really appreciate not having to drive into the Mass General Park, deal with the traffic, in order to get their imaging studies done in their community.
We are very careful to make sure that all of the community sites are up to the same standard as the general hospital. The equipment is just as new, it's just as up to date.
Whoever we're taking care of, that is our top priority. We're not worried about the people that came before, we're not worried about the people that are afterwards. Our focus is just one patient at a time, and that's our goal.
An example of this is actually my own son needed an MRI, and I wasn't sure how that would be. He was, I think 3 at the time, and I was so impressed by the quality and the dedication to making the experience in the pediatric imaging department wonderful for my son, but also for my wife and I.
I've been coming here for the last couple of years to have a CAT scan for my aneurysm. Yep, and they're obviously outstanding. And when I do come in here, as I said, I just treat me like part of the family.